Hello friends, and welcome back to Specialty Sessions. This will be our video lecture for lymphatic facilitation. So we're going to talk about a little bit about what that is, and we are then going to talk about the anatomy of the lymphatic system a little bit, and then we are going to talk about what some of the techniques are. So lymphatic massage or lymphatic facilitation is a very gentle form of massage. Because of where the lymph vessels are, you're just working like right at the level of the skin to just, if you can see this, to just hook and stretch the skin without pushing deeply in. You're just hooking and stretching the skin because that's where some of this stuff is that we're trying to affect. And this is going to encourage the lymphatic system to move fluid around the body. Specifically, it is going to take that shop vac and kick it up from medium to high to suck the extra fluids up from the tissues into the lymphatic system, and therefore, get it filtered and returned to circulation. So lymphatic facilitation means to help. So this modality speeds up the natural movement of fluids through the interstitial spaces, the spaces between cells in the loose connective tissue, and in the lymph system. So lymphatic facilitation is pretty straightforward. In terms of if you were to compare and contrast lymphatic facilitation versus manual lymph drainage. Lymphatic facilitation is much less complicated. It is easier to learn. It's very adaptable. It's easy to integrate into a massage session. It's sort of the generic brand lymphatic facilitation stuff. Manual lymph drainage is a precise treatment protocol. That is the trademarked, very specific clinical protocol that requires extensive training. So when you're done with this unit in our specialty sessions class, you will be able to facilitate the uptake of lymph in a person, in your clients, and you would be doing this generally for people that are mostly pretty much healthy. You're not going to be taking these techniques and working in very delicate cancer patients. You're not going to be going to someone that has a very complicated medical history. This is going to be a nice little add-on, a nice little beginner. Lymphatic facilitation can be very powerful, or manual lymph drainage can be very powerful. So that's the kind of thing you would get additional training for after school, after your basic training. And whereas what we're teaching is an intro, and you'll be able to do a session, but it's just it's the off-brand, easier to manage version. So what are some of the reasons that we might do lymphatic massage? So we would do lymphatic massage if this person has edema due to trauma. So this is, again, swelling from an injury. Totally okay to do lymphatic facilitation for that person. Sports injuries, a strained muscle, or maybe they're just generally worn out from doing some kind of marathon or endurance event. Allergies, like sinus allergies, we can do lymphatic work with. Sinus congestion, we can. Arthritis. This is one of the few techniques we can go ahead and work on somebody who's having arthritic issues, or having an arthritic flare-up, because it's so gentle and it's just going to help move and process fluid away from those joints. Totally safe and helpful to use on somebody who's experiencing arthritis. Headaches, generally good. Headaches can be caused by a lot of things. Scars, we can use lymphatic facilitation around scars. Somebody with a decreased immune response for whatever reason, this should be safe and healthy for that person if they've got that decreased immune function. There are, however, some contraindications. So those were the types of people we would do lymphatic facilitation for, but we've also got a list of things we would not do lymphatic facilitation for. So contraindications would be things like acute inflammation due to infection, allergy, or poison. So if you've got a little bit of swelling because they strained a muscle and it's just a normal healthy person with a bit of a muscle strain or a little bit of swelling, that person you can. But if you've got acute inflammation due to infection or some kind of allergic swelling from an allergic response, or if they have like some kind of actual poison, those are people that we should not be doing body work on. They might need like an ambulance depending on what's happening, right? So we're not going to be doing massage for this person. We're going to maybe be, bringing them to the hospital. So now we can tell the difference in terms of infection. Remember, injuries will be painful and swollen. Infections will tend to be hot and red, just a little bit more. And again, if someone's having an allergic reaction, we would not do that. All right, so any malignancies, so that's a cancer. Now, this is a hotly debated thing. There is really no clinical research that indicates massage and bodywork, including lymphatic facilitation, will spread cancer. This seems to be like cancer spreads because of the nature of the genetic mutation. And if it's going to spread, it's going to spread whether you do that bodywork session or not. However, in the lymphatic community, and in massage community, we've really kind of embraced that. In the lymphatic community, we still see cancer, active malignancy on the list of contraindications. I suspect that will be going away very soon because it's really not supported by science. But in any case, it is still on the list. Thrombosis, that's a blood clot. So if you've got, just like any time we're moving fluid, if you have someone with blood clots, we don't want to mess with that because we don't want to cause an embolism. Heart conditions or kidney failure. So heart conditions like congestive heart failure or cardiac insufficiency, and then also kidney failure. These are both conditions. Your heart pumps blood, your kidneys filter blood. These are both situations where your body's ability to handle the increase of fluid from the lymphatic situation is going to be impaired. So we don't want to take that struggling heart or those struggling kidneys and make them suddenly have to deal with an even higher workload. That would not be helpful. So immune suppressive medications, we're going to let those medications do their job. If someone has straight up lymphedema, that would not be appropriate for you to treat due to this class. Someone with straight up lymphedema requires complex treatment involving, it is complex and layered. The lymphatic drainage is part of it, but there's other parts too. They should be working with their doctor team. There's also like some bandaging and compressive things that happen. So somebody with straight up lymphedema, it's not really appropriate for you to walk out of this class and start working on them. That's just not what this type of lymphatic facilitation is for. If that interests you, you should get more training. And then pitting edema. Pitting edema is a sign of other stuff. We're going to stay away from that. And then any other condition that could be made worse by increased fluid circulation. Here's my kind of guideline. If I've got a client who has been told not to go into hot tubs or saunas, that's the person that we're not going to do circulatory body work on. Because a lot of times they're told not to go into those hot tubs or saunas because it boosts up that circulation, and that fluid management is exactly what they are having a problem with. So if you are not sure, if your client is not sure, ask them about their condition. You can ask them, well, have you been told to avoid hot tubs and saunas? Have you been told, you know, to avoid, do you have clearance for this massage? And you have these kinds of conversations. And don't be afraid to tell your client, I'm sorry for your health and safety. I think we shouldn't do this session today. Yeah, you can reschedule them. You can give them a discount on maybe some energy work if you do that. But yeah, we want to be safe. So we also have some things that are not straight up contraindications, but they are cautions, and we got to be careful and awake when we encounter these. One is post-surgery. You can totally work on someone post-surgery, but you do need to be cautious. Most surgeries, you kind of want to give them like 6 weeks before you fiddle with it. Some surgeries are okay after 4 weeks. Some surgeries you need more like 10 weeks, like a really invasive surgery, like open heart surgery or an organ transplant. You really should not be doing body work on that person before like 10 weeks. We are not the in the hospital acute care modality. We're the long-term maintenance modality, right? Anyway, kidney disease, depending on the disease, we want to be really cautious. Thyroid disorders potentially can be a complication, so we need to be cautious and careful. Bronchial asthma, chemotherapy. Active chemotherapy is very toxic to the body. It is a very powerful medicine, and it is one of the most toxic things that we're really going to see. So we want to be, the person's just going to feel sick. They're going to puke if you go in with some lymphatic facilitation when they're on chemotherapy. First trimester of pregnancy. This is one that I have opinions about. On the books, a normal, healthy pregnancy, having a relaxing, supportive experience should not in any way endanger that pregnancy. Women do not miscarry because a healthy pregnancy because they had a relaxing, supportive event. That is not the way the body works. You're gonna, when we're in these specialties, when we're in specialties like lymphatic, like other stuff, you're gonna still see some of the old myths that have been kind of expunged from your the normal mainstream massage therapy world, but still have their hooks in to some of these specialties. Personally, based on my understanding of pregnancy, based on my understanding as a physiology teacher, lymphatic facilitation should be perfectly safe to do on somebody who is having a normal, healthy pregnancy, even if they are in their first trimester. Pregnancy is not a delicate and dangerous medical condition. If they have complications, sure, but it should be fine. So anyway, removed spleen. Yeah, somebody's had their spleen out. Maybe be a little careful. And menstruation is on this list. So maybe just because they have a little extra fluid in general happening. Okay. So I am gonna now end this lecture video. And I'm going to do a second one where we start up and we talk about just the anatomy of the lymphatic system. So we'll end this video. That was the intro to lymphatic massage in general. Take a break, drink some water, and meet me back here for the next video on the lymphatic anatomy and physiology. Thanks, guys.